Welcome to the Dr. Dank's podcast. This week's episode sponsored by the Cannabis College of America.
All right, welcome to the Dr. Dank podcast. I'm your host, Larry Nagel, known as the notorious Dr. Dank. We have Scott Burgett, which is really, in my book, one of the leading authorities on the East Coast of the United States when it comes to cannabis. Scott's been in the industry for years. Rather than me talk too much, Scott, why don't you tell us a little bit about your background?
Like you said, I've been in the commercial cannabis space for 20 odd years. Been in the cannabis world almost my whole life. So I'm also a disabled veteran. I've had 8 knee surgeries to my left knee, tibial reconstruction of my right leg, 2 shoulder surgeries, and 3 back surgeries. So I've come from the VA opiate plan to getting off of opiates, getting my life back together with medical marijuana. Once I got off the opiates, went back to college, got my pre-med coursework done. I was accepted into both medical school and pharmacy school at the University of Florida. I chose to go into pharmacy, which was not the right choice. Once I got through the didactic part, I realized the job I didn't like. So I got into cardiovascular medicine. I worked in the cardiovascular field for 8 to 10 years and came out to grow medical marijuana when it became legal in Florida.
Excellent. One of the things that really drew me to Scott in the beginning when I first met him, he was introduced to me by a friend in common. And was his background, was the progression he made back to a good life. I had a brother that was also a vet. He wasn't so lucky. He wound up dead about 12 years after he came home. And, for me, Scott is an amazing success story. I know from my own personal experiences that cannabis is a lifesaver. I only have 2/3 of my heart left because one night I just blowed the other third the fuck up with coke, and and to be very truthful, I couldn't find. I mean, I suppose I should be really thankful I'm alive because for the longest time I kept trying to continually find a stronger and stronger drug to find something that was going to get me higher and higher. And then one day, it dawned on me if I just concentrated the weed I was smoking and smoked enough of it, I could get there with weed. And that's all I ever needed. And when I wanted to set it down and go do something else, or I felt like I was smoking too much and being irresponsible, I could do that. It wasn't controlling my life. So I think that's when, I really first understood what medicine really was in cannabis. Like you said, the first 30 years I was just getting high, man. Probably like a lot of us were.
Yeah, for me, until I really looked at it as a medicine trying to, again, everybody's experience with cannabis usually early is, hey, we smoked some marijuana, I got high, and that's my introduction to cannabis, and that's usually where the story ends, and people are usually cannabis users for life. Very few people quit. But again, everybody I know that's
Why would you?
but everybody I know that had to quit. Again, I worked in the medical field, Larry, where as a traveler, I had to, I'm changing jobs every 3 months, and I'm getting drug tested every 3 months when I'm doing that. If this was such a big, bad gorilla and had such addictive problems, there'd be no way in the world I'd be able to piss clean for a drug test for a job. And I know I'm not the only one. There's first responders. If we all want to speak honestly and openly about things, doctors use cannabis, lawyers use cannabis, judges use cannabis, your politicians use cannabis. It's one of the most widely used drugs, if we're going to call it a drug, on this planet. And people, I hate to say it, they're not man enough or woman enough to just go ahead and come out and openly say, yeah, I use cannabis. It's not that big of a deal. Alcohol is far worse for you. And I've argued this point for, as long as the medical cannabis space has been around. People worry about the addictive parts of it and the fact that people are overdosing and dying of cannabis. No, they're not. When they they come into the emergency room because they're so high they can't do anything. And when I was working in hospitals, people knew my experience with cannabis and drugs. I've always been very open about talking with people about it. So whenever they had drug overdoses, which were cannabis overdoses, they would call me, and it's like, okay, what would you like? Want something to eat? Would you like to watch cartoons? You want it in a dark room? And welcome to my world. It's a $500 to $750 visit to a room in a hospital to watch cartoons or Jeopardy or whatever the hell you want to watch. But it doesn't arrest your respiratory drive. You're not going to stop breathing because of cannabis.
Well, the lethal dose limit we were talking about the other day, I think even the Department of Health, the U.S. Department of Health states that 1,500 pounds have to be ingested in 15 minutes. I mean, how many different holes you got, man, to put this shit in? Yeah, and
and that's the same thing when we're dealing with when it first started as a medical remedy and states started taking it seriously. One of the big reasons to use it were for seizure reductions and epilepsy and dealing with that kind of stuff. But same thing, dealing with especially parents of young children. When this was first coming out, and you have to discuss with the parents that one, we're going to give your child an edible dose of cannabis. And by we, I mean you are going to do it. I'm not going to do it. I can't, I can make sure you have the product you need, but you're going to administer it to your child. That way everybody's committed to the cause. But when you administer this to your child might not wake up today. Your child might be asleep for 24 hours. Might be a little longer. You might try to wake them up and they will not wake up. They are that high, that under cannabis. They're not going to die because of that. They will come out of it. They will wake up. They will be okay. But it's a very hard thing for a parent to do or to experience with a child. But I mean, I've watched it with children that are having, 20 to 50 seizures a day. And if you don't stop these seizures, you're going to lose your child without any doubt. And to say that this is a medical product and it's been touted for for epileptic seizure reduction forever, for as long as cannabis has been medical in the U.S. That was one of the main things. Yet it was just last year, I think, where NYU found that CBD actually affects they found the receptor site in the brain, and now they know the receptor site that's dealing with this, and that yes, it does work. But this has been medical for how many years, and we're just getting to that.
Well, forever. A matter of fact, I guess up until about 5 years ago, 99% of every dollar that was spent on marijuana research was trying to find the negative side effects. Had no motive whatsoever in finding any positive value of it. I'm thinking while you're talking, the gentleman I met in one of the Zoom calls we talked that had the convulsion or the seizure problem. Wasn't it at a ridiculous level that wasn't even functional, and through CBD you got it completely under control?
Yeah, have you talked with Dave?
Yep, that's who I was.
Okay, yeah, Dave's one of my associates in my business, and again, he has seizure disorders bad enough that he has them when he sleeps. He's broken bones, orbital socket, arm bones, leg bones. He has very, very bad seizure disorders. And we've got them reduced by about 80 to 90% in frequency, and we've got them reduced 80+% in severity. So as he does still have seizures, definitely not nearly what they were. But again, as we can do medical research, and as people get more open to this, again, knowing the receptor site in the brain that CBD will interact with and stop seizures, how can I get CBD across the blood-brain barrier quickly and get it to a child or an infant that's got a seizure disorder? And can we actually stop seizures from happening? And the answer is yes to all of those. It's just a matter of getting the right delivery device and the right cannabinoids to that receptor site.
I was going to say, that Scott's been very instrumental and very scientific. What did I just hit on this? There we go. Anyway, he's been very scientific about his analogies and his, such as he's mentioned, delivery devices. Scott, rather than just say, "Oh yeah, go smoke a joint," is going to have this or that effect, and it's going to, be the definitive way to ingest it. Scott's went through almost every possible fashion of ingesting cannabis and isolates of cannabis for medicinal purposes, and that's another reason. Sort of, I have mad respect for him from that.
Yeah.
The scheduled substance issue. Before we get too far into the interview, give me your thoughts on that one, man.
I'm glad to hear they're looking at reducing the schedule level. What they're last I heard, they're looking at making it a Schedule 3 drug. Being Schedule 3 means it has a moderate to low potential for addiction. I still believe that this is a non-addictive drug. It's not a gateway drug. I was on hard drugs. I was on opiates. If it was a gateway drug, how come I quit every other drug I'm taking with cannabis? And I've reduced my drug intake with cannabis. This brand gateway drug ought to have me, hustling the streets looking for my next heroin shot or something like that. It just doesn't happen that way. People have different addictive personalities. So if you're a highly addictive person, and those people, I say it's not addictive as much as it is habit forming. Having a habit is not an addiction. I can tell you, I was addicted to opiates. When I stopped taking my opiates, when I wanted to go see my doctors, I was curled up, sweating, throwing, shaking. That's an addictive response. It's a physical addiction to a drug. Cannabis doesn't have that. When you quit smoking cannabis or using edibles, and I've talked to several people, it's like, I want to get high. I usually get high at this time of the day. I'm used to waking up and smoking a joint, and I got to stop those habits. But it's not like I'm sweating, I'm shaking. Oh, I'm just not going to be able to make it through the day if I don't get to smoke a joint. It's a different thing. I don't think it's addictive. I think it is habit forming. I think there's a social aspect to it also. People that smoke, that hang together, tend to smoke together. There's a social aspect and interaction to this plant that also has positive benefits for people. It's not like everybody goes and hides around the corner and smokes a joint and says, "Hey, let's go rough up the gang down the street," or "Let's go rob somebody." It's not that. It's more of a calming and a bringing together of people than it is. I don't know anybody that gets hopped up on weed and says, "Hey, let's go commit some crimes." It just doesn't work.
Is that, and you might not be real up on this, currently, and since what, 1972, Scott? I believe that's 72 or 73.
I believe it's 72-ish, right in that area.
Yeah. That's when they first scheduled cannabis as a scheduled controlled substance. Up till then, it was never scheduled. The definition, even the Drug Enforcement Administration's definition of a Schedule One controlled substance, matter of fact, I think verbatim, is a substance prone to abuse with zero known medical value. Now, what, we have 38 states with medical marijuana programs. We've clearly accepted marijuana as a medicine. Now, so once again, the brain trust that calls ourselves the Drug Enforcement Administration and those in power, they're reviewing it and they want to schedule it as a Schedule 3. Scott gave the definition of a Schedule 3. Schedule 3 drugs are still very dangerous drugs. Every drug, I believe, in Schedule 3 you can overdose on. If you want to really express this, drop down to Schedule 5. Schedule 5 is the lowest scheduled category. And that's where Xanax is at. That's where Valium's at. I mean, I have friends that their heart stopped and they're drinking whiskey and eating Xanax and they're fucking dead now. Do you know anybody that ever, like we were saying before, maybe additives, lacings, things that were with cannabis? But cannabis itself is never, ever, I don't ever remember having any negative reaction. Of course, I sure do love getting high. I think I was joking with you last night about it. It's not, with me, I don't consider it any kind of addiction because I know better, just like you, Scott. I've went through the withdrawals and there is none. But God damn, I have a love affair with this plant. And just the way, yeah, that's one of the main things about it, that it never feels like it has you by the ass. I
No,
mean,
it doesn't. And like I say, I've talked to several people, and I've talked to people getting into careers that require drug testing. You'd be surprised how many people ask me about things like that while I was in the medical field. And how do you beat these drug tests? It's like, I don't beat them. I don't beat the drug tests. I know I got to take a drug test. I stop, I get clean, and I take my drug test. And as long as I don't have an incident where anything happens or anybody turns me in or accuses me of being high on the job, and I've never come into work unable to perform my job or under the influence that would put a patient in any kind of level of danger, there is no problem. And tell them you just have to quit. Try not, you don't have to try to beat the system. Play within the system, get clean, take your job, and then after that, you should be good to go. Now, I used to travel, so I used to have to bounce up and down between, how many drug tests I wanted to take a year versus, but these are decisions we make as grown-ups. Is it worth my time, or is it important enough for me to quit smoking or taking? And I take edibles. I hate to say smoking. As a medical advocate, I don't advocate smoking cannabis. As a cannabis advocate, I say go get it. Go ahead and get yourself a joint and smoke it up. But for medical, there's better delivery devices and better routes to administer the medicine. But either way, it's nothing that I would ever call addictive. I don't know anybody, and I tell people, and I've had this debate on several different levels, from city, state, federal levels, of all the terrible psychosis and problems that we have because of marijuana. Line them up and bring them to me. Come on, cowboys, show me, line up the death certificates of everybody on cannabis that's overdosed on cannabis. And I want to see how you say it's an overdose. I don't want to know they died with cannabis in their system. Tell me they died because of a cannabis overdose. And that's the thing that There's such a, it's been legislated through fear. And that is how it became, scheduled and criminalized. But again, even go back to reefer madness. How many deaths were reported because of cannabis? And there aren't any. I've looked
Yeah.
for show me this great concern about cannabis that made you schedule this. How many people died of cannabis the 5 years prior to it being regulated like this? And nobody
Right.
can give me a number. So why did we go ahead and why did we start this war on drugs, war on cannabis?
Well, as we've discussed in the past, a lot of that whole war started from the fiber side and utility side of the industrial hemp, more so than it did on the drug side. The drug side sort of just got caught up in it. I'm not going to get into it in depth, but as you know, Andrew Mellon was the Secretary of Treasury of the United States. Andrew Mellon was also the Chief Executive Officer of Mellon Bank Corporation. Mellon Bank Corporation was heavily invested, overly invested, in DuPont Corporation. At the time they put their war against hemp to cause the initial prohibition, they had to find a way to prohibit the industrial hemp, which was a superior fiber at a lower price point, to the synthetic fibers that DuPont were producing and introducing to the market. Now, what I find so unique about this and so fascinating is the fact that all the synthetic fibers that were developed and took the place of industrial hemp after the prohibition all created carbon and all created a detrimental and negative effect on our environment. So, can't we just sit back and say, wow, man, they manipulated the law just so some people that were really, really wealthy and powerful could get even more wealthy and powerful. At the same time, yeah, let's fuck the environment. Those poor folk don't need to breathe anyway.
And
Don't mind me just stating.
I truly think that is the problem with cannabis. I don't think the health scare is the big driving push behind cannabis being illegal. Hemp or marijuana, whichever you want to talk about. There is so much money at stake. And hemp had been around since our founding fathers. You used to be able to pay your taxes with hemp.
Exactly
It was
right.
a standard crop. Farmers grew it without even a offtake for the hemp. There used to be a cheap offtake to use the fiber for rope, and they'd sell it for that. But that's not why they were growing it. They were growing it to enrich their soil. It's a nitrogen fixing plant. It fixes nitrogen in your soil for future crops. So everything above that was just bonus, bonus, bonus. And when you look at paper products, building materials, glues, resins, everything that can be made from hemp, and you talk about one company like DuPont, there's more at risk value-wise monetarily on the industrial side of this plant by far than there is on the medical side for this plant. Everybody that got into marijuana, and this is why I like the hemp space and why I kind of went from the medical to the hemp space, is one, I can do everything medically I can do with marijuana with hemp.
Right. I want to get into that in a minute too. I want you to explain that to the audience.
But the big money is day-to-day things that can be replaced or be brought back to hemp. And again, if we bring it back from these synthetics that are carbon positive production facilities, they're synthetically making product because somebody's putting a shitload of money in their pocket. The fibers they make are not stronger than hemp fiber.
Yes, sir.
They don't last longer than hemp fiber. They don't have as many uses as hemp fiber. So why are we pissing up that rope? Who's got their hands dry at the top of that rope and pissing up that rope to keep everybody else from pulling on it.
I was going to say it's
if you take the hemp and put it back in the industry and let everybody make product out of hemp and make it available to them, the farmers are going to love you. They're going to love it just for the soil amendment, let alone give them an easy crop that helps them nitrogen fix. It's a win.
an example of what you're saying, Scott, so the audience understands. When you intercrop hemp with winter wheat, or use it as a rotational crop with winter wheat, the wheat crop will yield roughly 20 to 25% higher after it's been intercropped with hemp, which shows a direct advantage of the nitrogen fixing. Not only that, but the nature of the root mass that is left in the soil from the hemp is an extremely good soil builder. It builds tilth like nothing else. Tilth is soil's ability to retain moisture, keep its loose texture so the plant roots can permeate it. So this plant, when it's utilized from an industrial side, does nothing but positive affect the earth that is being grown in. Now, the next thing we get to is, and you just hit on it, was the negative carbon footprint. Right now, our government is encouraging the sale of carbon reduction credits for those who burn fossil fuels to compensate for the amount of carbon they're putting in our atmosphere. When in fact, if they simply went to green fuels or fuels that were generated or manufactured from hemp, industrial hemp, there would be no need for it. We would end up with a net negative carbon footprint from all production of power. But evidently, the technology must be way too progressive, Scott. It goes back to 1863, man. I guess that's past our, mindset.
Yeah, we've only been doing it for almost forever. If you look into how long, look at ancient cultures and cannabis, and again, this plant's been around virtually forever. And again, it's a carbon negative plant. Takes CO2 out of the air, releases oxygen, sequesters carbon, and people go, what does it do with all the carbon? Well, carbon is the plant. So again, however many pounds of plant you grow per acre, minus the nitrogen, oxygen, 5 different chemicals that are in it, the majority of that plant's carbon. Now, if we can take it and strip herd from it and not have a big industrial cost to get the fiber usable, how much carbon does that save? And people go, well, I don't know. Well, look at how much companies like DuPont pay to have different fibers made. They're synthetic, so we're using energy, power, petroleum. We're burning carbon, wasting. We're just pumping carbon into the system.
I was going to say, let's look at electric cars. We got to burn fossil fuels so we can,
Yeah, we have to run big machinery to harvest the coal, to run the coal. Everything's carbon based, carbon. Go ahead and grow hemp. It's carbon negative. More carbon negative than growing pine trees. Acre per acre, I can get you 5 times the carbon credit plus on hemp than you will out of growing pine and other commercial woods. But now we harvest that if we make stuff like hempcrete and build a house or an office out of hempcrete block. That block will be carbon negative, meaning it will suck carbon out of the air for the next 100 years. And people go, well, how is that possible? It's just the nature of the herd. It's going to pull humidity out of the air. Museums are using it now for hempcrete rooms to help protect valuable historical items. The rooms built out of the hempcrete block will regulate humidity very well, so you're not getting moisture damage. It's fireproof and it's carbon negative. there's so much benefit for building materials with hempcrete. How come it's not happening? Where's the stick in the mud that's not allowing this to happen? How many fires do we have in California, Oregon, Hawaii? What if all those buildings and houses were built out of hempcrete and they had tin roofs?
Yep.
I bet you don't have a building burned down, right?
Well,
What's
it's
what's
like
the
this.
holdup?
Well, it's a shame, but from the beginning of the war against hemp, you have to follow the dollar. And when
Yeah,
you follow the dollar, you see very clearly that it's all been about personal profiting, excessive, ridiculous windfall profiting. This is the plant that, even the folks that got into the medical marijuana industry, they get painted today and stereotyped as being these wonderful, compassionate souls that felt so bad about the pharmaceuticals that so many of us were dependent upon. They had to give us an alternative. Fuck that, man. All it is big pharma taking over big cannabis. And,
yeah.
they're going to control us through cannabis like they've been trying to control us through pharmaceuticals for the last 100 years. They're just correcting one of their errors. But needless to say, you've worked a great deal with also people that had head trauma. Can you get into that a little tiny bit and the effects of what mainly CBD?
Yeah, CBD is the main trial we're doing, or the main cannabinoid we're looking at. I work with some patients dealing with CTE, chronic traumatic encephalopathy, concussion syndrome. If you watch NFL, that's what they're talking about. We're talking about closed head injuries, repeated closed head injuries over a period of time. It's hard to study because you can't really be diagnosed with it until you're dead and they do an autopsy on you. But through tracking NFL players and concussions, we know kind of where that line is. But dealing with some of these players, the cognitive issues, the dementia that comes along with it over time, all seems to be reduced or slowed with the use of CBD. Again, it's an anti-inflammatory. It's got neuroprotective properties. Um, I started with a couple of the NFL players, not even specifically for CTE. It was, I'm in pain all the time. My joints hurt all the time. Will this help my joints? And it's like, yeah, give it a try. And again, we want to get people up to a dosage or a therapeutic level when they're taking these products. And a lot of these trials don't work because they never get there. So what I recommend is taking 100 milligrams of CBD a day. I put it in a 3,000 milligram tincture. So if they take half a mil in the morning, half a mil at night, they get 100 milligrams a day. If you take that for about a week, you'll be at a therapeutic level in your body, which means you have enough CBD in your system constantly to be beneficial to you. Once people get to that point, they start kind of noticing things just disappearing off the radar. And one of my football players, his big thing was he called me after about a week and said, I just kind of realized I'm sitting here writing contracts, excuse me. He works for a propane company. And he goes, that's always been the worst part of my day is having to sit down and do the paperwork and fill out these contracts and get them because he can't hold a pen. All his knuckles are arthritic in his hands from playing football and grabbing big boys and playing hard games. But he said for him to be able to grab a pen and write and do he goes, that in and of itself is amazing. Then we talk more with his wife and family members, and yeah, he's a lot nicer boy to deal with. He's,
Oh, yeah.
so again, you have to look at the whole person, and a lot of medicine doesn't do that, which is a problem. look at the whole person, the whole being, and see how they're doing with it. But again, I cannot, I can't for the life of me think of anybody that hasn't benefited from it. I don't know if anybody's had any adverse effects from any of these treatments, and that's dealing with CTE. I've dealt with patients. The only thing that I've seen where there's a drug-drug interaction, I've used CBD for some patients with inflammatory problems, and they're also on Coumadin for a blood thinner because they have AFib and clotting issues. So it seems to be a protagonist with Coumadin. So if anybody's taking Coumadin and they decide they want to take CBD, speak to your doctor or at least have your INR checked to make sure you're not going to get out of hand. But I know, again, one of the football players' fathers who is he's on Coumadin. He's been very well tracked for tens, if not longer, years. And his INR was 2, which was great for somebody on Coumadin. They were very well managed. Within a week of taking the CBD, they're up to around 3, then 3.5 after another week. And same thing, we had to tell them to get off the, either lower your dosage of Coumadin or get off the CBD until you talk to your doctor and figure out where the dose of your Coumadin should be. Now, this patient's pretty alpha-oriented male anyway. And he's like, well, shit, they're giving me rat poison to thin my blood. That's what Coumadin is. He goes,
basically.
Why don't I just stop taking the Coumadin and just take the CBD? And it's like, well, I can't tell you to do that. I think it's a protagonist. I think you need to take some Coumadin. But why don't we get with your doctor and figure out how much we can reduce the rat poison you're taking? Where some doctors say, oh, you just can't take the CBD. It's like, what the hell are you So you want me to continue taking high volumes of rat poison as opposed to 1/4 of the rat poison you're giving me and take CBD?
Well, Scott, that's one thing I always loved about the traditional medicinal side or medical side of the world we live in. They very much seem to resent the introduction of cannabis into the cure. A friend of mine, we'll leave it at that for right now, had a severe drug addiction. She countered the drug addiction to going on Suboxone. I begged with her prior to her going on the Suboxone to please just try doing what I call my RSO cure. Basically keeping you so fucked up on RSO for 3-4 weeks that by the time you start to sober up enough to realize anything, you realize that you have not had to take these habit-forming drugs at all. So, are you an addict anymore? Fuck no, man. You've already went past the window of beating the habit, and wouldn't listen. Went on Suboxone. After about 6 months on Suboxone, one Sunday morning, she actually walked through the living room sort of whimpering. And I said, "What's up, bud?" And she says, "I'm addicted to Suboxone." She said, "I keep going back every month and I keep asking for them to cut it back like they told me they were going to." And she said, "They keep telling me, no, you got to maintain a static dose, man. Where if you don't, it won't work." And she said, "I don't like the way it makes me feel. My life, the quality of my life is fading because of it." And I says, "Can we simply do, the old Larry, Dr. Dank's fucking cure with RSO oil?" And I started feeding the girl large dosages of RSO. I mean, she had unlimited access to it, so she could do a couple grams a day if she wanted to. Kept herself pretty much comatose for the best part of 2 weeks. After about 2 weeks, I start jogging her to try to get more productive. She starts doing less and less of it. It only takes her like 3-4 days to step away from it. And that's when we sat down and had that great conversation of, think about this, man. You haven't taken Suboxone for the last 2.5 weeks. Do you realize you've beat it, no matter what they tell you, no what they convince you of? Now, the folks that were administering the Suboxone or gave her the prescription for it was my next door neighbor. This was in Florida when I lived down there. He had pain management clinic and drug addiction clinics. Mm-hmm. And during the period where I was giving her the RSO treatment, every day Joe and his wife had to stop by and tell me that I was running the risk of killing this woman. That, to withdraw from Suboxone in this manner can be deadly. And you don't realize what you're playing with. Matter of fact, one day Joe told me I had a God image because I was taking it upon myself to try to cure this woman in this manner. Ridiculous. The medical profession needs to become more perceptive to there's better ways to do things. Just because it's their way, don't make it the best way. As you know, if it was, Scott, they wouldn't have to list the 35 side effects for one cure for every drug that they sell through a pharmacy.
And if you look at the course of, or the status of medicine today also, and I hate to bring up COVID, but this will tell you, doctors aren't doctors like they used to be. My family grew up either in medicine or in farming. So I've got a lot of knowledge on how the medical profession has been handled for the last 50 some years. It used to be doctors were doctors. They worked with their patients. They figured out the condition. They treated the condition and the patient. Now a patient goes to a doctor. They diagnose a patient. And then they go to the insurance protocol of how we treat patients. It's straight business. It's not. It's one of the reasons I left the medical profession is, again, I like to treat people. I like to try to help people with illnesses. Medicine in the medical world right now, there's no money in the cure. So diagnosing you and putting you on a drug treatment plan that we can milk $200 to $500 to $2,000 out of your wallet every month is what this has become. Used to be a day and time you go see the doctor, and I'm trying to remember what the show was, Doc Hollywood or some shit like that.
Yeah.
Where old Doc Hogue, the boy's got a bellyache, give him some, and
Right.
that's how it used to be. No, now we got to run him for an MRI, get him ready for surgery, all kinds of shit. Well, you're about to crack open the chest of this little boy because he had an upset stomach. Here, drink this.
Yes, sir. Yes, sir.
And that's the way it was. But most doctors nowadays, they don't have to be a doctor. They have to know how to triage a patient, look for these identifiers, and if I have enough of these, I follow this. It's like just plugging them into an insurance model. And how are we going to charge this? It's how do we manage and charge an illness, not how do we cure a patient of an illness, if that makes sense. And it's a terrible way to run medicine. And again, no, they hate you bringing up anything that might lead people to believe they could be cured, or lead people to believe there's a better way with a healthy medical approach to things. As like I say, I'm into the fungal stuff, right? So there are so many ailments and conditions that have been treated for eons with natural remedies, and they've been cured with natural remedies, yet you can't find any of these remedies anywhere other than some old ass book that nobody's going to talk about.
Right.
The stuff's out there. It's just been, through our technological advancements, we have managed to alleviate a lot of common sense and good common medical practices.
Well, the technology of filling up certain individuals' pockets seems to be better than the technology to cure. We covered a lot of things today, Scott. I urge people to listen to also we had a sort of a dry run here a week ago where we covered a lot of different aspects of this plant, both the industrial and the medical side. The purpose behind, or one of the things I want to leave the audience with the most today, is the fact that once again, we're trying to reschedule a drug to a narcotic status that never was a narcotic, never was scheduled, and has no known lethal dose limit. When even the most coincidental and least harming of all of the Schedule 5 drugs you can overdose on. And I always found it curious. You can OD on chocolate, but you can't OD on weed.
And
Now,
Larry,
can you?
I would like to also volunteer both your and my services for this venture here. If they want to schedule cannabis, I think between me and you, we ought to sit down somewhere and have them bring us as much marijuana as they think it's going to take to kill us. And we'll get on this podcast and we will smoke till it's gone or till we die. I'm dedicated.
That sounds. I could definitely get down with that one, brother.
Yes, sir.
Well, Scott, this has been great for me. It's very commemorative of this whole project. The fact that this is a Memorial Day broadcast, our first actual audio and video broadcast. But yeah. Hopefully, this will only spell a brighter future for all of us who love this plant and live by it. I know it's changed my life and changed the quality of my life for the better. I know it's made you. It's totally reformed your life, and totally. I mean, I can tell my stories and say in some way that I would have wound up dead if I wouldn't have quit doing the other drugs. You, man, you're the clinical proof. Which God bless you. It's been a wonderful day. Have a good Memorial Day. Once again, I thank everybody for listening in. And this is Scott Burgett from Green Earth Cannaceuticals in Florida. And give them a call.
Yep. Thanks, Larry. Appreciate being with you. And if you need anything, feel free to reach out anytime.
This portion of the program sponsored by Green Earth Cannaceuticals. This week's episode sponsored by Buds and Brew Superstore.